This is the Fix Your Sciatica podcast.
Today we're going to be diving into the world of back braces. They're everywhere, promising pain relief, but are they actually helpful? Today we're going to be breaking down the different types, discuss their proper use, and explore what the research actually says about their effectiveness. But let's start off with the basics. What is a back brace? Now, back braces aren't a one-size-fits-all solution. We have different levels of support, from the comprehensive TLSO, covering the thoracic, lumbar, and sacral regions, to the more common LSO, focusing on the lumbosacral area. TLSOs are often recommended when you have issues and instability throughout your whole spine. Most likely this is due to a motor vehicle accident, experiencing a physical trauma like a slip and fall, or if you actually break or fracture a vertebrae or a backbone. You often start out with a more rigid brace, which will restrict motion for a few weeks. These rigid braces can be used as a short-term solution. So in some examples, think about that full body cast that you end up seeing on TV or in movies. And the other braces, which are going to be removable, which is usually made of a plastic or some sort of polymer held together by straps. And this is actually something that you'll see post surgeries, but then you'll also see this if you either know someone who has or is dealing with some sort of intense scoliosis. Usually with this type of brace, you're gonna need a lot of help trying to put this on because it's going to be covering a lot of area. And as the injury actually starts to heal, you're then gonna be transitioning to more of a flexible back brace. And flexible back braces are usually made primarily of some sort of cloth and some sort of elastic material. So it's compressive and it's stretchy at the same time. And the idea is that they actually provide compression and support to the area, aka your back. Now, compressive forces are pretty fantastic because of a couple different reasons. Number one, it provides a neurological safety net, also known as feedback. It gives you that idea of where your body is in space. And the flexible material actually allows your core muscles to do their job, which is to maximize stability, especially when you're moving your legs. But it also provides you enough freedom so you can actually move and engage your muscles versus the rigid ones, which just restricts motion. This will allow what I like to call controlled motion. The LSO, also known as the lumbosacral orthosis, is actually going to be the most common ones you're going to be seeing, and most often you'll find it out at the drugstores or even online, and you can purchase them on your own. They'll often just cover the areas located between your hips or your pelvis and your rib cage, and which provides support to your lumbar spine, and which is going to be the most mobile part of your back to begin with. So what does the research actually say that actually supports the use of braces? The links of actually all the studies I'm going to be referencing today are actually going to be found in the show notes. So in the post-operative space, one systematic literature review done in 2019, which is going to be a review of the numerous research articles to that specific date, actually concluded that there is no medical evidence to support the use of bracing after surgery for lumbar degenerative disease. And another article was actually surveying surgeons throughout the country, and the use of back braces post-surgery will actually vary from surgeon to surgeon. So it's going to be personal preference. So back braces post-surgery, really the answer to that is going to be it's something that you should be asking your surgeon rather than the internet or your own advice. So following what your surgeon is going to be providing for you, especially with the post-surgical instructions. In the non-operative space, one randomized controlled trial in 2019 where the experimental group used a semi-rigid back brace and the control actually used kinesio tape. Both parties or both groups actually had an education program, and it turns out that they too found that there was no benefit of wearing a back brace versus not wearing. One randomized controlled trial that actually took place in 2021, in which they actually compared the use of a back brace versus a control, in which the control group didn't use a back brace or anything at all, and incorporated what is called a back school, which is another education program. So we're looking at body mechanics and stretching and exercise. And what was interesting was that this trial too found that there was no benefit compared to not using a back brace at all. And so what ended up happening is, here we have all this information. It's like, why recommend a back brace to begin with? And so the answer to that is, back in 2018, there was a prospective trial following along 230 patients who were using various different types of back braces. And so this is actually something where they were following these patients long term. And although there were no, say, measurable improvements during the actual study in regards to objective changes, the subjective, or the actual description of the effectiveness of the back brace by the patient, by the wearer themselves, was actually good. And so what that actually meant was it provided a feeling and a sensation of feeling beneficial, where in some cases when you're dealing with pain, all you want to do is feel good. And so it could be a potential opportunity to be able to provide that safety net, allowing you to feel safe and move with a little bit more confident and less fear. And in 2024, the most recent article, a single-site retrospective chart review, meaning that medical records were analyzed for this study, actually showed that the combination of both physical therapy and the use of a back brace was helpful for pain. So the question is, what does all this research mean? My conclusion is that braces can help if you believe they will help you. But there's going to be some drawbacks to the use of a back brace. Number one, it can cause movement compensations. And what that means is that if you don't know how to actually move at your hips, also known as hinging, that loss of motion needs to be made up somewhere else. So if you don't know how to move at your hips, what we're going to be looking at is actually having to compensate at the low back. So you're going to be using your back a little bit more. And that brace can give you a little too much confidence. Or you might actually have to compensate by bending your knees a little too much as well to get the job done. And what's really important is that we should be hinging using our hips, which is going to be very important. I'm going to send you the hinge video, which is going to be found in the show notes as well. It can actually cause a weakening of the core muscles. And so when you're using actual mechanical blocks to your back, aka a rigid brace or something that's going to be restricting motion, and then you remove the brace, your muscles are going to need to stabilize your midline when you're moving up and around. However, if you haven't had the chance to use your spinal and your core muscles, which is going to be the front, your abdominals, to orient yourself and your body in space, then it can actually cause even more issues down the line. You could be using your back a little bit more because you're getting that false sense of security. Also, putting on a back brace can be challenging if you're in a lot of pain or if you don't follow the directions. Everyone's proportions are a little different. So the key is to actually follow the directions by the manufacturer and see if the brace truly does fit. However, I do believe that if you think you need some sort of support, then the use of a brace can in fact be quite helpful for you, as long as you know that you should be doing the following. Using the compressive forces to teach you how to brace your spine, specifically your core, your abs. Think about creating pressure against the compression. And so this is actually going to be similar to how weightlifters use a lifting belt when they're carrying heavy weights. And what that means is that when you're wearing a back brace, it's not permission to use your back muscles a little bit more. In fact, I actually see a lot at the hardware store that people are wearing back braces and they're using them improperly. So again, it's important to make sure that we are hinging at the hip, which means that with sitting and lifting, you're using the crease of your hip to generate movement and force, and not your knees, and certainly not your back. And you can see a video of actually how to properly hinge in the link I'm going to put into the show notes. Another tip is that limit your back brace use to about 1 to 2 hours a day, and when you are up on your feet. Realistically speaking, you do not need to wear a back brace when sitting down or laying down. And so another question is, well, what back brace would I recommend? I actually recommend the OTC lumbosacral support for both men and women. And it's actually a flexible and an inexpensive back brace that I found to be useful for my clients. It's lightweight and it's not going to break the bank. And it's easily adjustable with straps and Velcro, and it isn't too rigid. And so when I recommend this brace to my patients, I give them the following instructions to make sure that they're maximizing the results from this brace and preventing them from being extremely reliant and using this as a way to provide a little bit of a safety net, especially as they're moving around. Number one, limit wear to 1 to 2 hours a day at a time. Only wear it when up and moving around. And number three, ensure that the movement at the hip is in fact happening. And most of my clients only have to use this back brace for a week or so while they're following a rehab program to provide to them some sort of extra stability and comfort as needed. My affiliate link to this specific back brace can be found in the show notes. And as a physical therapist, I often use back braces as a temporary adjunct to treatment. I emphasize the importance of active rehabilitation and active movement. A brace can provide, again, support and relief, allowing patients to engage more effectively in their exercises to strengthen their core, their hips, and improve their movement pattern. The brace is just a bridge to recovery, not the destination.
Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.